Hello, hello, welcome to Talking Teeth. I'm from England, I'm Dr. Dane. We're going to talk about broken teeth and adolescents fracturing their teeth. Just kidding. There's so many kids from 10 years old to 25 years old on their bicycles. They're doing these scooter stuff. They're playing basketball. They're playing football.
They're skiing.
They're skiing. They're doing a lot of crazy stuff. Beer bottles, headshots, falling down, tripping. We get about 2 or 3 a month in Manhattan of broken teeth, fractured teeth, broken jaws, broken teeth. Did I say broken teeth?
Yeah, you did.
And it's a problem. Why is the problem? Because a lot of dental professionals don't know the protocol. Taking out the tooth is not the protocol. Okay? Saving the tooth is the protocol. Doing root canal treatment is the protocol. Stabilizing with a wire is the protocol. Going to the hospital is not your first choice unless it's on the weekend and you can't find a dentist. But if you can't find a dentist during the weekend, okay, go to the hospital. But a lot of people, during the daytime, they go to the hospital. What does the hospital do? They send them to the dentist. You got to go to the dentist. The dentist understands a lot more than the hospital does. They have limited materials and understanding about fractures. So we're going to start with the young kids first. For the most part, young kids, if they chip the tooth, no problem. If they break half the tooth and they're not in pain, no problem. Easy fix. Remember, when the tooth cracks, it's better. You say, no, it looks horrible. It's not better. Well, it is better. When the tooth cracks, it's better because that means the force got hit on the actual crown and the crown split. That took the force. When I see children and they hit their teeth hard and their lips are broken and the tooth is totally intact, I know that the force went up to the root. And when the force goes up to the root, it damages the whole biology of the tooth. Yeah. And those teeth become very, very bad long term. Yeah. So a chip in the tooth, a break half the tooth, a break in the middle of the tooth, it's fine. We can fix all that. When the tooth comes and it's in one piece, I get worried because that means they hit it in such a trajectory that the root is now hurt and there's a lot of inflammation here. So rule number 1, patients less than 10 years old or less than 10 years old, you stabilize everything, don't do any treatment. 10 to 25, if the patient has trauma and it's cracked, you bond the teeth, you fix the teeth. But when they have trauma and they're mobile, the teeth, you have to splint the teeth together. You can't leave them alone and do root canals. You must splint the teeth. Tell me your experience with young kids and accidents.
Kids heal quick. That is the beautiful part of it.
Yes.
So age is a factor when doing or choosing a treatment for it. For example, my kids fell down at a young age and chipped the tooth. But the chip was such that it did not involve the nerve. So that's where you're saying, yeah, the chip, as long as it doesn't involve the nerve, that's good. The moment it involves the nerve, then we have to talk about how are we going to cure that part of the nerve to allow that tooth to self-heal. Because the tooth could self-heal and it could create a barrier. But sometimes it needs a little root canal or it needs a certain treatment to preserve that tooth. In cases of the intrusion, which is trauma, usually when the kid falls in phase 4 first or hits their chin, the teeth go into the bone and the socket.
Especially when they're young.
Yeah.
When they're younger, less than 15 years old, this bone is very soft.
Yeah.
So if they hit the teeth, they get actually intruded.
So it changes the level of where the tooth are in the mouth. They go up.
Or they go out, or they go in.
They go out or in. The worst is in.
Right.
And then the ligaments around the bone suffer the inflammation factor, the healing factor.
Right.
And we have to monitor that before even choosing to say, oh, we're going to do a root canal. We do monitor 1 week. We do the testing to see the pulp is a vitality. Still at the 1 week, everything is inflamed. 2 months, 4 months, 6 months, 1 year. Taking x-rays and evaluating the tooth to see if it's going to change color.
Yep.
If it's in pain.
Yeah, if the tooth changes color, that's a sign that something needs to be done more than whatever was done. Another thing that all the parents and patients should know, when you take an x-ray of the patient, the top of the root, when the patients are young, the top of the root has not been fully formed. So when they take the x-ray, and I ask my patients to send me the x-ray with their phone, if the root is completely formed, it's a better result of healing over the course of time. When the roots are still open, 10 years old, 12 years old, and the roots have not closed, we got to save the tooth. So you do something to get rid of the pain if the person's in pain, but we want the natural process of that closing of that root to happen. Once they do the root canal and it hasn't been closed, it's a limited amount of healing over the course of time. That's why when you see patients, when they're 30 years old and they say, I have an infection here, I look at the x-ray, the access hole at the top of the root has never closed.
Never closed.
So I say to them, did you have an accident when you were 10? They said, how did you know? Because it never get a chance to close. So the root canal person, the dentist, has to know just to get rid of the pain part and not let that area close and take out the nerves. They lose the chance of healing. It's a big problem in our dental profession.
Yes.
Is there a difference in treatment if the tooth is vital or non-vital?
Right, well that's later on.
Okay.
Right, so if the tooth's non-vital and the patient comes in at, if you get traumatized at 15, root canal at 16, and now they're 30 and they get hit a second time, right? They're out partying or something happens, somebody hits them with their arm or there's a fight or something, or they fall. Like we see a lot of people falling with these scooters now. It's really, really bad. Bicycle accident. They're not wearing helmets. Come on, ladies and
No mouth
gentlemen.
guards.
It's 2026. Can you please wear a helmet? I got hit in the street like during the summer. I was walking in the street and a bicycle hit me. She went flying on the floor. And I look at her and she has no helmet. I go, what are you doing? You're in Manhattan with no helmet. What are you doing? And they got these bicycles, city bikes.
Yeah.
It's crazy. Why are you not wearing a helmet? You're going 30 miles an hour down the street. And she hits me and she starts yelling at me.
What's your number one tip? What's your number one tip for that mother that has her son playing in the playground and that front tooth just pops out because the hit was a big impact and the tooth is in the hand? They have how many minutes to make a decision
They got
to
10
take care of
minutes.
it?
That's
What
an
should they
avulsion.
do? What should they
Tell
do?
them what to do.
That's
Like
an
the lock.
avulsion
That's an
right
easy
there.
one.
So what you want to do is you want to put that tooth, either replant it directly, but you want to try to either put it in some solution like water, saliva is probably better, or even something called, I think it was a Hank solution.
Yeah, but don't. What they do is they have
Don't
dirt.
clean it off.
They have dirt and they clean off the dirt.
Do not
And they
clean it
shine
off.
the tooth up and they put it back in. It's too late. You lost
Yeah.
the tooth.
Yeah,
You
you're
have to
killing the
leave
cells
the
on that one.
natural tissue on the tooth. So you could wash it really quickly, or actually lick it and spit out, and then put it back in.
Yeah.
But cleaning off the root is going to
Yeah.
kill the tooth.
Putting it in water is not the first solution.
Milk?
No one has a solution. Some
Milk?
some
But
do.
who's got
some
milk
do,
on them?
Some do milk. So the best thing to do is to rinse it and put it underneath the tongue. So
Yeah.
leave it underneath the tongue and allow that to do it. Obviously, if it's a child like 8 years old, 10 years old, we want to be cautious that they don't swallow the tooth. But underneath the tongue, if you're an adult, you're playing around, tooth comes out,
And go right to the dentist.
and go straight to the dentist. Don't go to the emergency room because you're going to be waiting for hours. And you have the faster you get that tooth back into your mouth, the better it will be to have an opportunity to reintegrate the cells of the bone and the ligaments around it.
And make sure they put a wire on the teeth to stabilize the teeth. That wire's got to be there for at least 4 months. 4 months. Because that tooth is still regrowing, it's still moving, there's still areas that have to, you can't take off the brace after a month. It's not a good idea. So we tell patients 4 months with the brace, then you can reevaluate the tooth. Now here's another big problem. I see patients having the trauma, they went to their dentist because I wasn't around, they come back to me 2 weeks later, the stabilize is good, it's okay, and then they say, I have no pain, take off the brace. And I'm like, no, you can't take off the brace, we're gonna wait. The follow-up, now they go on vacation, they move, they forget about their tooth, and there's no follow-up. So listen to me carefully. You must, I'm talking about less than 21, you gotta follow up the patient every year of their life for the next 5 years. If they're 15 till they're 21, you have to follow that patient for at least 5 or 6 years. The growth of the patient between 10 and 20 is huge.
Yeah.
Huge.
That's a good point you bring out, Dr. Dean, because the only reason patients go back to the dentist
Is when they have pain
is when they have pain
or it looks bad.
or it looks bad. There's no
No good.
motivating factor to go back to the dentist because let's face it, no one likes to go to the dentist. But when you have these scenarios, unfortunately, you have to continue to take care of it.
Bring the patient back. Parents, I'm yelling at you. Please get the patient back once a year.
Yeah.
Because if you can grab the infection doesn't happen right away. It happens later. And if you wait till you're in pain, it's already too late. There's damage done, bones lost, the tooth moving, internal resorption, all these other things. If you can catch it early, you get into that endodontics, or you get into that root, or you get into that infection early, the tooth's going to be saved. Most of the patients that lose their teeth waited too long, and they didn't have a post-op.
Yeah.
And the younger they are, they can heal faster, like you said that. When you get into the 20s and 30s, it's a different situation. The tooth is already formed. They crack the tooth. We can save the tooth. We want to always save the tooth. Another problem that's happening in the United States of America is the dentist, the patient's 35 years old. They go to the dentist is like, oh, you got to take it out. Take the tooth out. We're putting an implant in. Ladies and gentlemen, please, dentists, patients, people around the world, an anterior implant is the most difficult implant to look perfect. The most difficult thing in dentistry to make look perfect. Do not take out the tooth unless it's a last resort. Okay? Listen to me. Anterior implants are not the best thing in the world. They're just not. They're very difficult, and if you lost the bone, it's going to look horrible and you'll be miserable the rest of your life. I have patients coming in, oh, can you fix my implant? No, it's too late. The bone is destroyed, implant's put in the wrong position. By the way, all of us have a different philosophy, and I want to bring it up to everybody. When you have to have an implant on an anterior tooth, you must, in my book, in my professional opinion, you should not get an implant unless you're at least 25 years old. So what's your number of age?
I agree with you. I stick with 25. No younger than no less than 25 years of age.
Yep, same thing. Age is a important factor in determining what type of treatment I'm going to give the patient.
Ladies and gentlemen, I'm going to repeat myself. There are dentists, including myself 30 years ago, I made this mistake. I put implants in 17-year-old females because I thought they stopped growing. The kids don't stop growing. They stop growing in your perspective of height.
Yeah.
The bone, the jaw, oral maxillofacial growth, till you're 35, maybe 40.
Yeah.
Listen to me. I've been doing this for a long time. I made the mistakes. I put implants in 18-year-old, 19-year-olds, 21-year-old, 23-year-olds. You know what happened? The implants got stuck here. The teeth moved. The tooth looks horrible, and now they have to redo everything. I made the mistake. I don't make that mistake anymore. 25 is my limit, and sometimes even then, I keep going till 30. What does the patient do when they're missing a tooth and they're 20 years old?
That's it. It starts hitting them emotionally,
So
socially.
what do you do?
You can give them something conservative, like a Maryland bridge.
Yes.
A bonded bridge.
Bonded bridge.
A bonded bridge, an Essex retainer, Invisalign, something so they can go out and live their lives from 20 to 25. That's probably the hardest psychological time for any child, 15 to 25. So we want to give them a tooth. We're not saying don't give them a tooth, but let's bond it to the other teeth. It looks beautiful. Colors can match beautifully. And as the body grows, now the bridge is growing, and now when they're 25 to 30 years old, they can get the implant. This is a big problem in America. They're putting in implants too young. I just had another patient on Monday. Hi, how old were you when you put the implant in? 19. Forget it. I don't even want to look at your mouth. I don't even want to treat you because I can't make it look good. I can't. It's impossible.
Yeah.
So please stop putting in implants in patients less than 25 years old.
Yeah.
Let's go to the next topic.
My approach to the aesthetic zone and age, I always look at this, how can I be more conservative today on a young patient so that when that patient's 30 and 35, I still have the opportunity to do a root canal, a crown, an implant
Crown
at 35,
lengthening.
crown lengthening.
Right.
Don't just jump to the implant solution because it's the new best thing. It's out. No. Give the patient the opportunity to have longevity with the treatment they currently have. Yes, do a bonded veneer or crown on the front tooth. Allow that patient, when she's 18, to live up to 28 with a front tooth, natural, God-given tooth.
Right.
If that, for some reason, has internal reabsorption because after several years, we take x-rays and we see the inside of the tooth is being consumed. We have to treat that now. That's when we come and talk about dental implants. So yes, it's one of the most challenging procedures even for me, Like I actually charge double my fee for a tooth in the aesthetic zone because I know it's going to take me 4 to 6 hours to achieve what I want to have as perfected.
We're talking about
to the
20
factory
hours.
tooth.
Some of the anterior implants take about 20 hours of our time to be there. Laboratory costs are $3,000-$4,000. So it's a very expensive undertaking, and that's why I try to talk them out of it.
Yeah.
I rather do a bridge or a bonded bridge because I know aesthetically, people want aesthetics. You can't get aesthetics with anterior implants. It's very rare. It's like 3 out of 10 look really good. The other ones look okay, and some of them look horrible. So aesthetics, when people say I want aesthetics, well, get a bridge, get a beautiful replacement. I have a bridge. I don't have an implant on my number 10. Why? I used to box. All my teeth were root canal, and as time went on, they started decaying and started breaking apart. I lost one. I've kept everything else. If you look at my root on an x-ray, it's this big. It's tiny. But I don't want to get rid of it because I know once I lose it, it's all over. I don't know how old I'm going to be when I lose it, but I've gotten through my 50s and my 60s with it that I'm still holding on. I'm holding on to nature as long as I can because that's what looks the best.
This is where a topic that I've been discussing with a good friend of mine, Dr. Knife Sinata, we've talking about the 4th generation of dentition.
Yes.
What is the 4th generation? Well, when you're born, you have the baby teeth, 1st generation. Then you have the adult teeth, 2nd generation. What is 3rd generation? When you have your veneers, when you have your crowns, when you have your root canals. You, during that 20 years of age to 35, you're living through that 3rd generation of
maybe even up to 40 or 50.
Maybe 40, 50, right? That's where the majority of our patients are in.
Right.
But then there's that new generation that... Did you know dental implants were created for 80-year-old patients?
Right.
Because their denture did not fit?
Right.
Now the new thing is bringing younger patients to do implants. No.
Right.
Give patients the opportunity that when they're in the 4th generation of dentition, then they get their implants.
Yes.
So they're 45,
it's a big problem.
50, 60, now they're enjoying that dentition.
We've come up with a couple of little tips. Age-based strategy, okay? Young patients, preserve the pulp, preserve vitality, avoid early root canal unless you have to do it if there's pain. Middle-aged adults, predictable healing, early root canals if necessary, if there's necrosis or a darker tooth, and keep the tooth as long as you can, even if you have to do crown lengthening, and save the tooth with a new crown. Hold the crown for 10 years. Do a second crown with a second post and a second retreat when they're in their 40s. In their 50s, okay, now I could take the tooth out, put the implant so they can go from 50s to 60s to 70s. And at 70s, maybe we'll redo the implant.
The biggest thing that a patient doesn't want to have is the regret of doing something they wish they didn't. And it's usually, I wish I didn't take out my teeth to do implants at a very young age. Give yourself the opportunity to understand what are the benefits of doing dentistry without implants and what are the disadvantages of doing it too early. That has to be a conversation that you have to have with your clinician, your dentist, to understand what's the best fit for me today so that I could enjoy a longer life with my natural dentition.
I mean, you've been doing implants for 20 years. You have seen a lot of younger patients that got it way too early and too soon.
The way I see it is God gave you these teeth and they're perfect. What am I going to do better than he can or she can?
That's it. My drop.
That's it.
My drop. But it's
Straight bow tie.
definitely the scenario we're in. Like marketing in the wild. Let's talk about dental implant marketing. It's a big deal because it's coming to patients' iPhone. It's patient to Instagram, on Facebook. They're getting all this information because it's cheap. Implants don't get decay. Implants don't get fractured. No, that's not true. There's other consequences of dental implants, but it has to be treatment planned the right way at the right time for a specific patient.
Listen, try to hold the teeth. That's the key. I'm going to give you some key factors here. Where are my key factors?
Key factors, is the tooth fractured?
Key factors.
Fractured or displaced?
Is the tooth fractured or is it displaced? If it's displaced, we got to put it back in position, stabilize it.
Yep.
If it's fractured, we can repair it, root canal, crown lengthening, keep the root as much as possible. A lot of 18-year-old, 15-year-old patients keep the root. The dentist saying, take the tooth out. No. Wait till the patient's 30. Then we can look about it because now the bone is already grown. Second factor, is the pulp exposed? Is the nerve exposed? If it's exposed, we got to get the pain out, but take a look at the root. Make sure the root is closed. If the root is closed, we can do the root canal. If the root's not closed, try to hold it together.
Mobility.
How many teeth are involved? The patient hurts on the front tooth, but the other tooth are mobile. We say splint the 6 teeth together. Splint them all together. Have like a little brace for 6 months so that everything kind of grows together and heals together. The teeth that are stable may not be hurting, but they will help the other tooth that's loose and that's actually damaged. And the teeth that are solid will help. So the 6 front teeth are the strongest, especially the canines.
And the apex.
Yeah, the apex, I said that. So what is the patient age? Remember, we have patients in their 70s. If they crack the tooth, what are we going to do? I'm going to do the root canal, put a post in that day, probably not even have to give them anesthesia. There's no nerves, right? And then you fix the tooth and they say, oh, I want an implant. I go, no. We're not doing implants on you. First of all, if the tooth already had the root canal, right? Think about this for a second. They had the root canal when they were 20s. They have their post, they have their crown. Now they're 60, 70. That tooth is ankylosed in that bone. You can't extract that tooth so easily, right? You've done it. You're going to say, oh, we're going to take it out and put an implant in. You damage the whole bone by taking out the tooth because it's ankylosed. So those fractures, again, I'll repost the tooth, crown lengthen the tooth, put the crown on again. I'll see you in 10 years. Let's buy another 10 years for you.
Yeah.
Out of occlusion so it's not hitting. Aesthetically looks much better than an implant.
True.
So what am I doing? I want to preserve the tooth as much as possible.
Yep. Same here.
Are you sure?
No, same
Because I see
here.
you putting a lot of implants in.
I do a lot of implants because patients that come in are not just missing one tooth.
Yeah.
They're compromised
That's
periodontally all
different.
around.
Yeah, that's different.
They have periodontal disease, bone loss. They have the amount of dental work that they need in their mouth is bigger, larger than the amount of dental implants that could be treated.
Let's talk about the soft tissue because people talk about teeth all the time and implants and crowns. A lot of times when the trauma happens, the gum is affected. Now, there's something we call in the dental world called a buccal plate. If you were to peel away your gums, there's a very, very, very thin piece of bone at the outside of your roots. So your roots are basically in a hole of bone, and the outside, the facial buccal plate, is very, very thin. Now, unfortunately, some people have thin tissue, some people have thick tissue. If the patient has thick tissue, it's a lot easier.
It's easier.
Right? But we have a high smile line, young female with very, very thin tissue, and she gets traumatized and say, oh, no problem. We're going to take the tooth out and we're going to put an implant in. The doctor must have CBCT scan, must see where the buccal plate is, because we diagnose every implant patient with a buccal plate analysis. If the buccal plate is missing, even 2 millimeters, we will have a gingival defect.
Well,
And when the patient looks in the mirror and says, oh, I don't like the way it looks, it's too late.
It's a nightmare.
Talk about that.
It's a nightmare. The after effects, especially psychologically, with any type of a gingival defect or soft tissue defect after trauma like that, is devastating to a young woman, even a young male.
What about patients that never had their tooth? Like sometimes we have congenitally missing laterals, and people don't have a tooth that comes in. They have a bonded bridge till they're 25, and now you want to put an implant in.
well, that's a very challenging spot because the bone is very similar to the muscle. When you don't use the muscle to exercise and lift weight and move, it atrophies, it becomes thin, it thins out.
Right.
The bone becomes a very thin plate. And then you waited too long to place that implant, now you have no bone.
So what's the age range of those guys?
It's not the age, it's actually how much thickness
Is still available.
is still available after so many
Yeah.
years. After 18 years of never having that bone, it's tough. So there are techniques with the orthodontist where the orthodontist, if the canine is in the wrong position, let's say the canine is now in the middle of the face.
Right, they're missing the lateral, the canine moved over,
Yes.
they have to move the canine back.
Now there's a technique that we move the canine back, then we reanalyze to see if there's enough bone created because of that movement. And even then, there's another surgery to add more bone to
Right.
build up that space. So that's what we're talking about. Implants in the aesthetic zone, it's a big challenge.
You
but
can have
done well and planned well with the proper specialists and communication, you're going to have a good success.
So that's a big part about specialists. We have the periodontist, the gum specialist. We have the oral surgeon who does a lot of surgery. We have the restorative dentist. We have the implant dentist. Now, if your dentist is expert in all these things, that's very rare, but it does occur. There's a lot of people that have experience with that. So what I'm trying to tell everybody, number one, preserve the tooth. 1 crown, 2 crowns, 3 crowns, as many crowns as you can get. Crown lengthening, periodontist does crown lengthening. Let's hold on to the tooth. But once you get to the implant world, now you got to think about all these other things. Aesthetics, time, what are you going to wear as a provisional, how much pain you're going to go through, how many surgeries to create the tissue. Sometimes you have 5 surgeries to create the tissue that was lost. So again, before moving that tooth, before extracting that tooth, this analysis must be made for that patient. Thin tissue, thick tissue, biotype, smile line, occlusion, where they're biting, how their bite is. I've seen implants put in patients that are grinding and the screws break, the porcelain break because it wasn't diagnosed correctly. This is what we're talking about. There's too many variables to go through and saying, I'm going to take my tooth out and put an implant in. Please be careful. Save the teeth as much as you can. That's all I'm saying.
Yep. That's my day-to-day challenge with many patients because they say, take my tooth out, put an implant. I don't want to spend the money on a root canal porcelain crown. I prefer to do that money for my implant. And it's the biggest conversation I have before I even present treatment to my patients.
I want to bring up another point. Hopefully you never have to deal with this, but if your child or yourself or anybody, your friend, goes to the dentist, take the x-ray. Take a photo of the x-ray. A root and a tooth is just like any other physical anatomical structure. There's a root part and there's a tooth part. You don't have to be a genius to figure out that if the tooth size is 25 millimeters and you fractured off half of it, you're going to lose the tooth. But if you fractured off a quarter of it, we want to save the tooth. So the question is, how much of the tooth has been fractured? Is it a third? Is it an eighth? Is it a quarter? Is it half? Because once you're past the 1/3 mark and 2/3 are left, it's kind of hard to replace.
Or is it the 1/4 mark is what I have on the email.
Quarter. We're talking about a quarter of the tooth is fractured. We can go ahead and save that tooth.
I want to play devil's advocate.
Yeah.
There has been cases where the fracture was not visible at the time of that x-ray being taken because the view that was taken on the x-ray, the crack was invisible.
Right.
Fast forward 6 months later, you see the crack.
Yes.
But because there was no infection on the tooth, there was no
mobility.
That crack healed because the bone cells were there, the
Yes.
osteoblast was there, odontoblast was there, everything created, and now the tooth might be ankylosed, but the tooth is still vital.
Right.
So that's the one-off,
Yeah,
right?
yeah. The vitality of the tooth is probably paramount. Remember, if the vitality remains, vitality means the blood vessels are going, the nerves are working, and the body will heal. That's just the way the body does.
Yeah.
And as long as you stabilize it, that's why I said immediately we always put splints on. We want to have those teeth locked in position so the body has a chance to heal the way it is. Now again, sometimes, like Dr. Publio said, you have resorption, but look, you're checking it in 6 months, we're checking it a year, checking it in 2 years, checking it in 3 years, checking it in 4 years. It may happen 5 years later, okay, the teeth's fine. And they said, oh, I'm fine, I'm not coming in. No. Again, the younger the patient, the more we're looking at the patient. That's the point. But the fractures, like sometimes, like you said, you can't see it on the x-ray. They said, it really hurts, doc. We don't see anything. So we don't know why you're in pain. So now the pain becomes paramount because the patient's hurting. And on the other side, there's no pain at all. They feel wonderful. So you have all these different variables going on. You have to have a smart diagnostician. There's one diagnosis. There's definitely 5 to 10 different treatments of the patient. But my take-home message is save the tooth as much as you can. Buy time as much as you can. Treat the patient as much as you can with crowns and root canals and to save the teeth. And then implant is the last option,
Yes.
not the first option.
Not.
Yeah, I mean, you mentioned earlier, like older patients have a certain term that I wasn't familiar with.
Ankylosis.
Ankylosis. And I was wondering, is that like, is the tooth more closely fused with the bone? Like what issues?
That's what that is. It's fused
Okay.
to the bone, so it's hard to take it out.
Sure.
What happens is the root's there, and then the body starts eating it away. So it's a resorbing the tooth away. You
It could
see,
be
like
from the inside out,
it's like
or it could be from the outside in.
it's like the own body, the cells react and said foreign body, because that's called resorption. Like the own body resorbs it. But you want to catch it early. If you catch it early, you can get there. If it goes too far,
Like you can stop the resorption?
No, you got to just take the tooth out,
Okay.
or do some procedure to stop it.
Gotcha.
But if you wait too long, the whole bone gets destroyed.
Yeah, and
'Cause
then
the
if
body's
that's the
eating it.
foundation to the crown, that
Yeah, and
becomes
then you have no foundation for the implant.
Gotcha.
So you want to get resorption early on, and it's really slight when you can see it. You say, "Oh, we got resorption. Let's do the root canal." Now the resorption stops. You look at it again, 6 months. Oh, the resorption coming back. So once you see resorption, that's the body healing it, like not healing it, taking away and eating away of the tooth. You want to get that out as soon as possible because you don't want to ruin the bone now for the implant. So that's a double-edged sword.
And then with the
Congenitally missing teeth.
Yeah.
They never got the teeth. They grew up.
Well, they were born without it, but you're saying like, I guess the solution, right? Because you guys were talking about like, oh, when do I put in the implant?
There's a missing tooth,
Do you
right?
put it in young to fill in that space?
No, that's what people do. We don't want to do that. We want to
Okay.
put a little bonded in there, a bonded bridge,
Just to make the space good.
space, and then you're maintaining the space until they get older.
Okay.
Then you put the implant in.
And then you're still testing the actual jawbone you're going to install it into.
Yes.
Yeah. Interesting. What are your thoughts on this, like Jake Paul, getting knocked out by Anthony Joshua and breaking his
Well,
jaw in
first
two
of all,
places?
you're boxing, so anything could happen in boxing. I used to box. I broke my teeth. Big falls. We have a lot of trauma cases, real trauma cases, where they break the jaw. Usually, when the actual jawbone breaks, they have to put titanium mesh to hold the jaw together. Sometimes teeth are affected, meaning they come out, they break. Sometimes teeth aren't affected, just the jaw broke. So that has to do with what broke. You have this jaw, which is mobile, the lower jaw, has condyles, a ramus, and a jaw. So he got hit here. This part cracked. They put a titanium mesh and put it together. I don't know, did he lose any teeth?
Probably right at the side of the
He
fracture.
did lose teeth.
Okay, so he lost sight of the fracture. So the most important thing, obviously, is to stabilize the jaw.
Destabilize the jaw.
Yeah, upper fractures are more complicated because now you're dealing with the sinus and the eye. So you can have a jaw fracture that actually breaks the eyeball and you see the eye just drop down. Those are, again, maxillofacial traumas, a little bit more than what we're talking about teeth. It's a real problem. We have a lot of friends, not a lot, but I'll say a handful of friends that, kids go to college, they get crazy, they fall down and they break their jaw. So it does happen. That you have to go to the hospital immediately. They must wire the jaw shut. We'll deal with the teeth later. That gets shut down for 6 to 8 weeks. So 2 months, they're in the jaw, they're drinking through a straw. That's a problem.
Yeah.
That's a bigger issue. But here's the good news. As long as they don't break their maxillary bone, their orbital, and their nose, the jaw we can fix. The lower jaw we can fix anytime, anywhere. When they start breaking the zygoma bone, the orbital bone, the sinus node, now you have deformative of tissue. Because remember, the tissue follows the bone. If the bone is offset or broken, it's going to affect the way they look. If this jaw is broken, they're going to swell up, they're going to suture it back, and they're going to be fine. So lower jaws, I'd rather break it. Don't ever break your jaw. But if you're going to break your jaw, break your lower jaw.
And he had several teeth removed in the operation.
Yeah.
So I guess I'm assuming those are probably like teeth that have died or something. Like they lost their vitality.
It's just a crack.
It's most likely that where the crack happened, it was the actual, we talked about the tooth living inside a wall of bone.
Mm-hmm.
So that tooth no longer could be stabilized in that spot.
And they literally fall out.
So they had to splint side to side and keep the jaw back into its own place, but the tooth would not be able to survive. I mean, first of all, that fight should not even have
17. Okay, hold on. December 19th, 2025, Jake Paul, severely broken jaw, losing 7 teeth. 7 teeth. How old is he, 25, 30?
I mean, how much did he make in that fight?
Somewhere around like 30 million.
30
Oh,
million
perfect.
dollars.
So 30 million divided by 7 teeth. It's not bad. It's not bad. I think he's doing okay. 7
a little over
teeth is
4
gonna
million a
cost
tooth, right?
him.
Oh my
7 teeth is
God.
going to cost him about, I don't know, $25,000, $30,000. I think he's good. I think he's good.
I think he's good.
It's a cost
You
of
can
doing
always
business.
replace the teeth. You can't replace your eye. Well, you can, but it's not easy.
How about the brain? I mean, I feel like.
Can't replace the brain.
Yeah.
No, getting into that fight, I think that was a little bit more than he could ask for. But
He was fine afterwards, though. He didn't say nothing.
I
He
mean,
didn't complain.
he took it like a champ. So
He took it like a boxer.
yeah,
Like a
yeah.
champ.
So props to
Did
him.
he win or lose?
No, he
lost. I mean,
knocked
you
out.
Let's ask the 17th.
Yeah.
All right.
That's great. I think
we're good.
Yeah, I think we're good.
Thank you, everybody, for listening. Hopefully, you never have to deal with traumatic teeth. If your child or your friend or your brother, sister, mother, sister, relative get into a fracture, call us, call your dentist. Try to get the tooth in. Save the teeth. Save the whales. Save the trees. Don't take the teeth out. Please. Implants are great as a last option. Love you. See you soon.